Hello everyone, I am Dr. Satish Babu, Senior Consultant ENT Head and Neck Surgeon working in Bangalore. Earwax is a normal secretion inside the ear canals, right? From the pinna inside there is a small tube going inside which is the ear canal, which will end up in the eardrum. That's a blind sac. So the outer 1/3 of the ear canal contains wax secreting glands and some sweat glands also. So the secretion of wax is happening on a day to day 24/7 on all of us, right? Like sweating, some people sweat more, some people sweat less, some people sweat that has a smell, some people sweat which is not smelly. Same way wax also varies in its character. It can be thin, it can be thick, it can be fluidy or liquidy, or it can be solid. It can even harden and become almost like a stone, right? However, this wax production is individualistic, and between the ears of the same person there can be a change in the character of the wax. It can be grey color, yellow color, brown color, maroon, sometimes even dark brown or black in color. However, these are normal variations, right? Having more or less wax is again a normal variation, and by itself a normal wax is harmless. It is secreted because it is needed there. You don't need to go and dig it out every time you feel that there is some issue with the ear. None of the ear symptoms like itching in the ear or pain or ear block or pus formation, infection, none of these are caused by wax. Rather, lack of wax could lead you to the problem, or if you introduce some other factor into the equation like moisture from outside, or if you are using earbuds or sticks somewhere, you are going to cause more trouble. So keeping the ear dry and not worrying too much about the quality or the type of wax that you have is the best thing you can do. Cotton buds are not designed or meant for removing wax, right? They are basically to remove excess water or moisture that has gone into the ear while bathing or swimming. It is being wrongly used in our society for clearing wax. Wax is not supposed to be cleaned from the ear, wax is supposed to be there, that is why it is secreted, and earbud is not meant for that. So they don't go together. If you try to do that, you are going to cause more trouble. First of all, the earbud is a solid thing and the wax is secreted on the skin. So if you use something solid like this, it is going to keep pushing the wax deeper and deeper. Whereas in a normal person, the wax is only secreted on the outer 1/3 of the ear. Now if you push wax deeper and deeper, it will get collected inside, right? So you are creating more trouble by trying to clean it with an instrument which is not supposed to be used for that. And if the earbud is being used a little roughly, you will hurt yourself, especially if it is just a soggy skin. After a bath or a swim, the skin has become soggy. You won't even know how much of pressure you are going to be applying there, because your skin becomes a little less sensitive after becoming soggy. Now if you are being a little rough with it, you are going to peel off the skin or create a bigger wound, and that will create more trouble. You will have ear pain, infection going inside, and it's not that wax is supposed to be removed. So don't use earbuds at any point of time in life. Like I was saying, ear wax is a natural occurrence and it is secreted because it is needed, very much like the saliva in your mouth. Now why would you want to meddle with it, first of all? Second, olive oil or any such oil, if you apply, it is going to remain inside the ear canal and it will keep that area moist, right? That is the idea of using an oil, so that you have some moisture inside. But the counter problem is that the moisture can lead to fungal infections or any such thing, because ear canal is a dark, warm place where you have dead cells from the skin, you have dust falling from outside, you have wax secretion coming from outside, and you have the protein from the oil. So all these things will facilitate infection, especially fungal infection. So keeping the ear dry will be the best thing that you can do for your ears, right? Even the same goes for the commercial ear drops. But if you have identified that there is a solid piece of wax sitting in the ear, either by shining a torch inside and seeing that ear canal is full, or if your doctor has told you that there is a huge chunk of wax which is hard, we cannot remove it at this first sitting, then you can use some dissolving ear drops for a few days so that the wax becomes softer, and we can either wash it out or do a suctioning so that the ear opens up. But other than that, I don't see a reason why we should use oil or ear drops regularly. Even for a post-operative patient who's undergone a ear surgery, we give ear drops only for a short period. We would prefer the ear to remain dry as much as possible. Earwax is secreted by the skin of the ear canal. So, if there is an accumulation for some reason, either moisture has been there inside the ear consistently by water entering, or you are using some ear drops, or if you are pushing the earwax with cotton bud, pushing it all the time deeper, it is going to slowly get accumulated, right? The earwax secretion is actually very minimal. It just forms one very thin layer on the skin. Anything beyond that should dry up and fall off. But for some reason, like I mentioned before, the wax gets accumulated, and if it is blocking the entire ear canal like a bottle cork, then your hearing will go down by 10-15%. You will feel that blocked sensation, slight numb sensation and all that. In that situation, we can use ear drops and then go to the doctor to get it cleared. Even if I have wax, I am not going to remove it myself. I will have to go to my colleague to get it removed. So please don't try it at home. Just soften the wax if it is identified properly, and then go to the doctor to get it cleared safely without causing any other issues. There is no concept of regular maintenance or regular removal of wax from anybody's ear, be it a child or an adult. Wax is a natural part of your body. You need to leave it inside because it has protective properties. It protects the skin, keeps it moist, prevents infection. It has an antiseptic property. There is no concept of cleaning the ear on a regular basis. Even if you see a big chunk of wax inside somebody's ear, it doesn't mean that you should go and clean it up. Even in our clinical setup, we examine the ear routinely. As far as we can see the deeper part of the ear and the eardrum beyond the wax, we just leave the wax alone even if there is a big chunk. So, there is no regular maintenance meant for the ear, be it a child or an adult, especially so in child, because have to be protected. So, keep the ear dry, prevent moisture inside from going from outside, and just leave the wax alone, and the wax will dry up and fall off automatically. However, if you notice the child is not hearing well and you see a chunk of wax in the ears, then you can get to the doctor, make sure the wax is removed, and then if the hearing is still bad, then we go for further investigations. Do not try anything at home. The earwax can only cause ear block, 10-15% of ear block, when there is sufficient wax to fill up the ear canal like a bottle cork. Now, that we cannot remove it at home, you cannot do it yourself. So, then you have to go and meet a doctor. Other ear symptoms, obviously, like ear pain or itching or any other discharge or pus or anything like that, you will obviously go to a doctor. But only a plain earwax problem will, with sufficient wax, will only cause ear block, 10-15%. So, that time you can go to the doctor, confirm it is only wax, nothing else is happening there, use the ear drops, or if they can, they will remove the wax at one sitting. If not, if it is too tight or too painful to remove, you are sensitive, then you can use the drops, make it softer, come back for a wash or a suction clearing.